Sources in the Union Health Ministry reveal that Home Ministry will hold video conferencing meet with Kerala today. The Union Health Secretary will also attend. It could also be decided if another central team needs to be sent to Kerala to assess the situation. Maharashtra will also be part of this meeting. Milan Sharma for more on that. Milan, do take us through. Here you have Union Health Ministry revealing that the Home Ministry will be holding a video conference with regards to Kerala spike. What action will the Union government now want to take?
Well, Nabila, it's part of a constant monitoring that the central government is doing on its part. So therefore, this video conferencing will be held by the MHA, and what we've heard from our sources is that the Union Health Secretary will be attending the video conferencing. State of Kerala and Maharashtra have been asked to be part of it, especially after the huge surge that Kerala is witnessing post-relaxations after the Onam festivities. The central government had already sent teams not once but more than twice now to assess the situation on the ground, and reports have been prepared. It could also be decided today whether the situation warrants that another central team be sent from Delhi to check what is the ground situation in Kerala and why more cases are being reported, despite the fact that the union government has written to the Kerala state to contain and stop these cases, to not allow relaxations during festivities. But that has clearly, just after Bakrid as well as Onam, led to a spike in cases where Kerala test positivity is higher than 20. But on their part, Kerala says that their hospitalizations are low. And therefore, the central government is also keenly watching the situation there, Nabila.
Right, Milan, thank you very much for joining us with those details. I'm going to cut across to Gopi, but before that, let's take a quick look at the COVID case count in Kerala in just the last 1 week. On the 19th of August, you had 21,116 cases that were reported. And then on the 20th of August, a day later, a spike by 100 cases at 20,224. And then you have August 21st, it dipped at 17,106. August 22nd dipped further at 10,402. August 13th, it reported 13,323. August 24th, it reported 24,296. And August 25th, it reported 31,445 cases. Let me cut across to Gopi Krishnan Unnithan. Gopi, it's very evident here that right after Onam festivities, it appears that the Kerala COVID cases have shot up once again. Has the Kerala government addressed this fact? What are they doing to combat it?
Well, Nabila, during the first working day after the Onam celebrations, the government had called for an urgent meeting to review the COVID-19 situation in the state. And in that meeting, it was decided that the vaccination and testing will be intensified. So the golden rule for the government at the moment, it seems that it's going to be vaccination and testing maximum people. So we have been speaking to the experts to try and understand the logic behind these two strategies. The government says that vaccination is actually one way of ensuring that if a person is vaccinated, then even if he is contracted with COVID-19, then the chances of his viral load getting serious is much lesser. And on the other side, on the testing part, if the government is able to test and identify maximum people, then they can isolate them at the earliest. Now, right now, I'm at one of the mega vaccination centers here in the state, which has been functional for over a month now. You can actually see the people who are waiting here taking their turns. And even when we look at the vaccination data from Kerala, the Kerala has so far actually vaccinated about 55.08% of the population. Now, according to the State Health Department, according to the nodal officer for H1N1 and other communicable diseases in the state, he says that even though the cases have increased in Kerala, the hospital threshold hasn't really been compromised yet, is what the government is saying, because the government has also put out the data which shows that roughly about 57.1% of the total ICU beds have been occupied so far. The total other, this is the non-ICU beds, the ICU bed, ventilators and non-ICU with oxygen supply, all these beds are actually well within the capacity, is what the data is suggesting. Now, this is one excuse or one defense that the government is taking to try and give an impression that though the numbers are rising, it hasn't really contributed to a major surge or major pressure on the hospital threshold in the state. Now, if you look at the numbers, if you still just go back to the numbers, Kerala's active caseload is about 1.5 lakh. and the daily death toll is also increasing. Yesterday, 215 fresh deaths were reported in the last 24 hours,
right.
And the overall death toll is mounting, climbing much closer to 20,000.
Well, that's tragic because Kerala, in terms of the death toll, they were doing fairly well over the last year. But now it appears that they have not been able to control this surge, and even the death toll is on the rise. Why is Kerala surge really worrying to India? Well, it shows that the state has been quite lax in restrictions. Of course, it confirms low community immunity rate as promised and assured by the Kerala government. And it also shows super spreader events that are still going on. In fact, any of the celebration that's conducted in Kerala, it results in a spike in COVID cases, including Onam, the latest, establishes flouting of COVID safety norms, which is now quite evident with the laxities in controlling large-scale events. Now, shows that the government's COVID strategy is clearly not working. Gopi, these are the reasons that is quite well established, and we do know well, looking at the pattern from the first wave, the second wave, that large gatherings, events that involve people coming together, no social distancing, that results in a spike of COVID cases. And knowing very well, Kerala in fact had the first 3 cases when the pandemic just started. So they know the intricacies of the COVID-19 virus, and yet they've allowed for rules to be violated brazenly.
Well, Nabila, if we put forward this question to the administration, they would say that it is actually a very tricky position for the state, because during the first wave of the pandemic, just before the national lockdown was imposed, Kerala was among the first bunch of states to go into a complete lockdown, and that is how it managed to contain the first wave of the pandemic. After the unlock proceedings started somewhere between July and August, that is when the caseload started increasing in Kerala. Now, during the second wave, we saw a much different scenario in the state, because the cases started increasing in the state somewhere after April. So that was actually after the elections that the cases started increasing, and May was the time when this caseload reached its peak, when the daily case tally was touching the 30,000s and 40,000s on a regular basis. After that, it's actually true to point out that the caseload hasn't come down considerably. At one point, the daily test positivity rate was somewhere around 29,000, to 29%. From 29%, the state managed to bring that down only up to about 10% or 8% over a period of 2 months. Now, that was actually a period of plateau, is what the experts would say. And
right.
After that, while there were restrictions imposed, there was a lot of uproar on the public domain for the shops and establishments to be opened, for the relaxations to be implemented.
Well, that kind of uproar has been across the country. People are suffering. We do know that, but life more important than livelihood at the moment. We're seeing Kerala and its laxities resulting in the spike of COVID cases across India, the only state with this number.